Firstly, we will encounter with the trapezius muscle, external occipital protuberance. The origin is external occipital protuberance and medial one-third of the superior nuchal line, ligamentum nuchae, C7 spine, T1 to T12 spines. And the insertion of the trapezius muscle is upper fibers into the posterior border of the lateral one-third of clavicle, middle fibers into the medial margin of acromion process and upper lip of the crest of the spine of scapula. Lower fibers on the deltoid tubercle at the junction of medial and middle third of spine of scapula. The nerve supply of trapezius muscle is spinal part of accessory nerve, branches from C3 and C4. Actions are upper fibers act with levator scapulae and elevate the scapula as in shrugging. Middle fibers act with rhomboids and retract the scapula. Upper and lower fibers act with serratus anterior and rotate the scapula forwards around the chest wall, thus playing an important role in abduction of the arm beyond 90 degrees. Here we will go to the second muscle of the back region, that is deltoid muscle. It is divided into clavicular part, acromial part and spinous part. The origin of the deltoid muscle is clavicular part is origin from anterior aspect of lateral one-third of clavicle. Acromial part is origin from lateral border of acromion. Spinous part is origin from lower lip of the spine of scapula. The insertion of deltoid muscle is deltoid tuberosity of humerus. The nerve supply is axillary nerve and the actions of deltoid muscle are flexion and medial rotation by anterior fibers, abduction by middle fibers, extension and lateral rotation of arm by posterior fibers. We reflect the trapezius muscle medially. We will encounter with three muscles, mainly levator scapulae, rhomboides minor and rhomboides major. First we will go to levator scapulae. The origin of levator scapulae is transverse process of C1 to C4 vertebrae. The insertion of levator scapulae is medial border of the scapula between the superior angle and the root of the spine. The nerve supply of levator scapulae is dorsal scapular nerve and C3 and C4 spinal nerves. Actions are elevation and medial rotation of the scapula. Second muscle is rhomboides minor. The origin is from lower part of the ligamentum nuchae, spines of C7 and T1 vertebrae. The insertion is base of the root of spine. The nerve supply are dorsal scapular nerve. Actions are retraction and elevation of the scapula. Third muscle is rhomboides major. The origin is from spines of T2 to T5 vertebrae. The insertion is medial border of the scapula from root of the spine to inferior angle. The nerve supply are dorsal scapular nerve. Actions are retraction, medial rotation and elevation of scapula. Next muscle is supraspinatus, that is above the spine. The origin is medial two-third of the supraspinal fossa of scapula. The insertion is superior facet of greater tubercle of humerus. The nerve supply is suprascapular nerve, that is C5 and C6. Actions are initiates abduction of the arm and carries it up to 15 degrees. The next muscle is infraspinatus, that is below spine. The origin is medial two-third of the infraspinous fossa of scapula. The insertion is middle facet of greater tubercle of the humerus. And the nerve supply is suprascapular nerve, that is same as supraspinatus. And the actions are lateral rotation of the arm. Next muscle is teres minor. The origin is upper two-third of the dorsal aspect of the lateral border of scapula. The insertion is inferior facet of the greater tubercle of the humerus. And the nerve supply is axillary nerve and the actions are lateral rotation of the arm. The next muscle is teres major. The origin is inferior one-third of the dorsal aspect of the lateral border of scapula. The insertion is Medial lip of the intertubercular sulcus of humerus. The nerve supply is lower subscapular nerve. Actions are adduction and medial rotation of the arm. Next, we are going to the next muscle, that is latissimus dorsi, the widest muscle of the back region. The origin is spines of T7 to T12 vertebra, iliac crust, lower 3 or 4 ribs, and inferior angle of the scapula. The insertion is floor of intertubercular sulcus of the humerus. The nerve supply are thoracodorsal nerve, that are C6, C7 and C8. Actions are adduction, extension and medial rotation of the arm, raises body towards arm as in climbing.